Hello everyone, I am Dr. Shankar Dey. Welcome to 9th video of NEET-PG 2022 recall questions discussion. Coming to the question number 81. Question number 81 was mentioned about Samter and the question asks which drug to be avoided in this patient. So drug to be avoided. As all of you know, Samter consists of three things: rhinosinusitis with polyp, nasal polyp, bronchial asthma, and NSAIDs intolerance, non-steroidal anti-inflammatory drug. Among the options given, I think one of the option was aspirin. So in this patient, non-steroidal anti-inflammatory drug like aspirin should be avoided. So here in this question, answer will be aspirin should be avoided in a patient with Samter. Next, coming to question number 82. Question number 82 was about a middle-aged lady with cardi-white discharge from the vagina. So what is the diagnosis in this case? Cardi-white discharge in seen is vaginal candidiasis. So this is a typical case of vaginal candidiasis. And what is the culture media to isolate the organism? That was asked. So culture media, this is obviously fungal. So for fungal, the culture media will be SDS, Sabotodextrose agar. So Sabotodextrose agar is the answer for question number 82, with lady with cardi-white discharge from vagina, suggestive of vaginal candidiasis. Next, coming to question number 83. Just the question was image based question. The question asked was about the staging of bed sore. As all of you can see here, not only skin and dermis, epidermis, also the subcutaneous tissue along with deeper plane like muscle, bone is exposed. So this is definitely a higher stage. This is stage 4. This is stage 4. So this is stage 4 bed sore. As all of you can see, here is the list of stages of pressure sore. In case of stage 1, as you can see, only epidermis is involved in stage 1. In case of stage 2, epidermis and dermis is involved. In case of stage 3, epidermis, dermis and subcutaneous tissue fat are also involved. In case of stage 4, deeper plane like fat and bone is involved. In this case, it is stage 4 of bed sore. Coming to question number 84. Doctor under influence of alcohol cut down vessels of a patient's major blood vessels and he or she dies afterwards. So this is example as the patient dies due to cutting down of major vessels causing death of the patient. This is definitely criminal negligence. So this is not civil negligence or therapeutic misadventure. This is criminal negligence. One of the important topic for upcoming NEET-PG examination. Next, coming to question number 85. That was also an image-based question. As you can see in this image, there are various sinus discharging sinus-like structure around the anal region in perianal region. This is not pinoneedle sinus. The options is ruled out. This is not carbuncle. This is actually fistula in ano, multiple fistula in ano. As recalled by my juniors, I think this type of image was given. This can be fistula in ano. Coming to question number 86, a 30 years old male semen analysis was done and it shows azoospermia, and what image was given like this type of similar image was given. So the diagnosis was asked. This is not necessarily testicular atrophy. This is not orchitis. This is not non-seminomatous germ cell tumor. This is more likely Sertoli cell only tumor. So this is Sertoli cell tumor. Coming to question number 87. A female patient with multiple genital warts on analysis high risk human papilloma virus was suggested on laboratory analysis. So which will have the maximum risk? As all of you know, see here multiple lesions on the around vulva. This is genital herpes, and as you all of you know, high risk HPV includes HPV serotype 16 and 18. 6 and 11 is low risk, 16 and 18 is high risk group. So among the option, HPV 18 will be the correct answer for this question. Coming to question number 88. In trial of court, defending lawyer asked leading question. An opposite lawyer raised objection against this, and the judge sustained the appeal and requested the defending lawyer to avoid leading question. So the question asked was, leading question cannot be allowed in any of the following except. So the question was about except, cannot be allowed except means where leading question is allowed. Leading question is allowed only in case of cross examination. So the answer is cross examination where leading question can be asked. Leading questions are not allowed in examination and chief. In direct examination, also in dying declaration, leading question is not allowed. Next, coming to question number 89, FDA status in the body is determined by which? So as all of you know, FDA or this is not FDA, this is FAD. So this is FAD status of a body is determined by which enzyme? As all of you know, FAD or FMN is the active form of vitamin B12 or riboflavin. As riboflavin enzyme activity to be checked for riboflavin status is it is glutathione reductase. So glutathione reductase level is the correct answer for the question to check the FAD status in the body. Coming to question number 90, complex 4 inhibitor or inhibitor of electron transport chain. So let's learn the electron transport chain inhibitors like complex 1 or NADPH CoQ reductase inhibitor is amytal-rotenone. Complex 3 is antimycin A, and the question asked about this complex 4 or cytochrome oxidase inhibitor. This is cyanide and carbon monoxide, not dioxide. So this is not dioxide, carbon monoxide. So obviously the complex 4 inhibitor is cyanide. And look at the other inhibitor that is also important for upcoming exam like ATP synthase for oligomycin and ADP translocase atractolyside and bunkelate. So this is the about question 81 to 19. In the next segment, I am going to discuss question number 91 to 100. So stay tuned for the next video and don't forget to subscribe my channel, Dr. Shankar Dey. Share the video with your friends, juniors and seniors. Thank you very much.